management, monitoring of adverse effects following immunization or AFIC, at ang IT, Information Technology System, na kinakailangan sa pagrerehistro ng napakamalaking bilang ng mga mababakunahan. Tutulong din po sa risk communication ang community engagement plan, ang Philippine Information Agency at ang PCOO. Malaking plano ang mga ito, kaya naman to ensure alignment and harmonization, nagtalaga ang atin Pangulo ng isang vaccine czar na si Secretary Charlie Galvez, na kasalukuyang din na Chief Implementer ng NTF. Next slide. Sa pamumuno ni Secretary Galvez sa atin vaccine cluster, they will be working closely and hand in hand with the IATF and the NTF in harmonizing and aligning the efforts of the lead agencies that will manage and implement the activities on COVID-19 vaccine delivery under the three major components, no? Yung vaccine development, vaccine procurement, and yung distribution and rollout of vaccines to our people. Alalahanin din po natin that this is a new vaccine to combat a new disease, kaya kailangan din natin ng strict and thorough monitoring procedures and protocols. And which is why our vaccine cluster shall be guided by 3 independent expert advisory groups. Alam ko, ito'y nabanggit na dati, pero magandang ulit-ulitin natin. Ito po yung Health Technology Assessment Council or HTAC, na nakapalo po ito bilang mandato sa ilalim ng Universal Healthcare Law. Pangalawa po, ang National Immunization Technical Advisory Group or NITAG, at pangatlo ang National Adverse Events Following Immunization Committee or NIFIC. Ang tatlong expert advisory groups na ito ang may technical expertise para gabayan tayo ng ating vaccine cluster sa pagkakaroon ng isang malinaw at evidence-informed judgments and decisions patungkol sa paggamit ng bakuna. Ang lahat ng ito ay para sa ikasisiguro ng patuloy na kaligtasan at pagiging epektibo of the COVID-19 vaccine. Tandaan po natin, bagong bakuna ito, no? So, kinakailangan talaga ay ang masusing pagkilala, pag-analyze, no? Pagsusuri ng mga kaakibat na mga datos, no, mula sa mga iba't ibang vaccine manufacturing companies. With this daunting task, our country's response to the pandemic, next slide. With this daunting task, our country's response to the pandemic is predicated on a whole of government and whole of nation approach, bolstered by the Filipino people's bayanihan spirit and ingenuity, empowered by agile decision-making that is informed by the best available scientific evidence, enabled by the trust of the Filipino people. Thus, we call upon all stakeholders concerned sa kabila ng lahat ng ating paghahanda sa IATF, sa NTF, sa mga pamahalaan lokal at sa buong gobyerno, kinakailangan pa rin po namin ang tulong ng mga mamamayan, maski ang pribadong sektor, civil society organizations at ang mga non-governmental organizations to deliver this vaccine to every Filipino who needs it. Gayunpaman bilang inyong IATF Chair at Secretary of Health, habang tayo ay nag-aantay ng bakuna, let us acknowledge that the virus is here to stay. But this does not mean that we should be paralyzed by it. With the minimum public health standards, we are equipped to live with the virus as we successfully go about continuing our lives. That being said, ibig ko pong magtapos na dito at ibig kong ibigay naman ang pagkakataon kay Secretary Carlito Galvez Jr., ang ating NTF implementer and vaccine czar, to present in detail the Philippine National Vaccine Roadmap. Sa muli, maraming salamat.
Thank you, sir, Secretary Duque. Before we proceed with Secretary Galvez's presentation, sir, we have a few questions from the media for you, sir. We have two questions po. Let's start po with the first one from Gerard Daval from Malaya. For Secretary Duque, with 2020 set to end in less than 2 months, are we anywhere close to flattening the curve, considering that many of our identified indicators have met their respective goals? Also, sir, he's asking, many countries in Europe have seen the second wave of COVID-19 cases. What is the likelihood of the Philippines seeing a similar scenario as we attempt to reopen our economy?
Yeah, well, ang siguro dapat malaman ng ating mga kaibigan kasama sa media ay ano na ba ang ating tagumpay sa pagtugon sa COVID-19 pandemic, at how have we managed this? And hindi naman may pagkakaila na talagang marami na po tayong panalo. We have scored significant gains in terms of our response. And importantly, equally important, is we have ramped up our health system's capacity over the past few months of battling with this pandemic. Unang-una, meron na tayong 159 registered COVID-19 testing laboratories. So malaking bagay po ito. Imagine mo from 1 to 159 COVID-19 testing laboratories. That to me is one of the game-changing accomplishments of the administration. Meron tayong 110 labs in Luzon, 25 labs in the Visayas, 24 labs in Mindanao. And this has ultimately allowed for faster turnaround, or yung TAT turnaround time for the test results, and less backlog, which is crucial in identifying the appropriate level of management of our patients. Ngayon, also, I'd like to inform our media partners, as of November 4, there are now 11,225 TTMFs, quarantine, and 16 mega TTMFs nationwide. Meron po pangkalahatan na 168,440 total bed capacity, at ang utilization rate ay asa 27%. At ito po mga pasilidad na ito ay nagkaroon tayo. This allowed us to decongest our hospitals and provide care for patients who are unable to isolate in their homes. Ganun din, as of November 4, nationwide healthcare utilization rates ay umabot sa 51%, whereas ang utilization naman ng ating COVID-dedicated beds ay bumaba din to 38%. Ang ibig sabihin nito ay meron na tayong sapat na kapasidad para tugunan upang bigyan kalinga at mapangasiwaan ang ating mga active cases. And then also, insofar as the efficient delivery of health services through the One Hospital Command Center na pinangungunahan ni Yusek Leopoldo Bong Vega, ay nagkaroon sila sa kasalukuyan mga 78 daily transactions, at this allows us to efficiently manage the referral of cases, therefore delivering sufficient care and treatment to the suspected, probable, and confirmed cases. At may dadagdag lang din po ako na 76% or 25,298 health workers ay amin na-employ, at ito ay na-deploy para tumulong sa pagtugon sa mga local government units. So meron din tayong napalawig na telemedicine consultations, dahil alam nga natin na may takot pa din ang taong bayan sa pagpunta sa mga ospital para magpakonsulta sa kanilang mga doktor. Kaya naman minabuti ng DOH at ang kanyang mga partners na magtalaga ng telemedicine consultations. At ito po ay umabot na sa 71,000 more or less as of November 3 na tumugon sa mga COVID-19 and non-COVID cases. No? At ito rin ay nakatulong para maibsan ang pagpuno sa ospital at higit sa lahat maibahagi sa mga pasyente ang tamang medical information sa mas mabilis at mas epesyenteng pamamaraan. At ang panghuli, ang DOH naman ay patuloy ang pakikipag-ugnayan at yung collaboration with LGUs that allows us to give faster and coordinated health emergency responses. Pamamagitan nga nung sinabi kong code team efforts, no? Coordinated operations to defeat the epidemic. So, itong mga nakaraan panahon, nakita natin na patuloy na pagbaba ng kaso, yung daily number of cases, at we attribute this to our continuing efforts and localized responses at the barangay level. And that is why we thank our local government chief executives, our barangay health emergency response teams for tirelessly working on the ground. And of course, we also thank the support through continued cooperation and compliance of our public to our response strategies, and in their continuing compliance, if not disciplined compliance with our minimum health standards or non-pharmaceutical public health interventions. So this downward trend is certainly a welcome development, Gerard. Hopefully maging patuloy na ito, pero ika nga pwede pa rin tumaas ulit ang kaso natin kung hindi tayo mag-iingat. Kagaya na nakita natin sa Europa, sa Amerika, ay nagkaroon na sila ng mga second waves, no? Kung tawagin. At sana ay hindi tayo matulad sa kanila. At nakita naman natin na mukhang ang ating mga kababayan ay talagang nasunod. Karamihan, ang majority, talagang nagkaroon na ng disiplina na sumunod sa ating minimum public health standards. At sana itong trend na ito ay magpatuloy. At nananawagan ako na sa pamamagitan ng ating bida solusyon, ito yung napakamahalaga na panuntunan ng ating gobyerno, ng DOH, ng IATF. Huwag po natin sayangin ang lahat po ng ating mga nakamit na mga tagumpay. Huwag po tayong magluwag, huwag po tayong maging complacent. Let us not let our guards down and gumamit tayo yung ika nga sasalubungin natin, unti-unti na natin binubuo yung konsepto ng new normal sa pamamagitan ng paggamit ng face mask, face shield, social distancing na sapat, yung ating pong hand washing, respiratory or cough etiquette, frequent disinfection as our general advisory, public health advisory to our people. And in fact, in the transport sector, meron din silang tinatawag na 7 commandments, no? Na kaakibat nga nito ay ang mga nakapaloob sa atin bida solusyon campaign, no? Of course, may dinagdag lang sila doon na dapat walang sasakay na pasahero na symptomatic, dapat siguraduhin ng DOTR na air cycle change is frequent enough so that the virus spread is prevented, and yun na nga, bawal kumain, bawal magsalita, bawal tumawag, bawal tumawa sa pagkaasa loob ng mga public transport. So, yun lang, Gerard. No? Pasensya na kung medyo mahaba-haba Dahil madalas din ito ang aking inuulat kay Pangulong Duterte sa lingguhan IATF with the meeting with the President.
Thank you, sir, for answering that question. We hope that answers your question, Gerard. Let's move on to the next question, sir. From Nika Hanapol of Verifiles. Have we determined how many people we need to vaccinate to establish herd immunity?
Ideally, ang gusto ni Presidente, lahat na makunahan. Pero syempre, maraming variables dito. No? Unang-una, kaya bang ang global supply? Kaya bang tugunan yung demand? So dahil merong mga limitations, no, ay kailangan magkaroon ng prioritization. At kami ni Secretary Galvez at Secretary Boy de la Peña ay meron na po kaming listahan na inihanda, yung list of priorities. Sino ba dapat ang mga mapakunahan? In general, ito yung mga healthcare workers, mga frontliners sa mga hospital, emergency rooms, etc. At mga healthcare workers din ng mga DepEd, DSWD, at mga barangay health workers, at yung pong mga empleyado ng Bucor, Bureau of Corrections, Bureau of Fire Protection, Bureau of Jail and Management Penology, at mga uniformed personnel of the PNP and the Armed Forces of the Philippines, at mga, syempre, si Pangulong Duterte, bigyan prioridad ang ating pong mga mahihirap na mga kababayan. So ito po ang ating mga indigent population, million po ito, at syempre yung mga mahalaga din kasama dito ang vulnerable senior citizens, mga 60 years and above, at yung pong mga pregnant, yung mga iba pang mga vulnerable population. No? Hindi pwedeng ibigay ito sa mga buntis kasi hindi pa natin alam, baka may issue on safety na maka-apekto sa kanilang pagbubuntis. So we have to be very careful about this. Ganun din sa abigan. Yung abigan nga, isa sa mga contraindication dyan yung pregnant women. Ano? Dahil it is known to cause teratoma. No? This is a tumor that may be brought about by intake of medicines that may hamper the normal development of the fetus. So ito lang ang ilan sa akin na mga tugon.
Thank you, sir. Those are the questions we can accommodate for the Secretary of Health. We will now be moving on to the presentation of Secretary Galvez. Sirs, thank you po once again. Sir, your final message before we move on to the presentation of Secretary Galvez.
Ang akin lang pong mensahe at kasama po dito ang buong IATF na huwag po tayo magiging pasaway, unang-una. Pangalawa, ay sumunod po tayo sa lahat po ng panuntunan ng ating pong gobyerno para talagang mapanatili natin na mababa ang bilang ng ating COVID cases at mababa din ang bilang ng mga pumapanaw. Ngunit siguro magandang gamitin ng pagkakataon ito na ang bilang ng mga pumanaw ay actually sila din po yung may mga tinatawag na comorbidities o may mga sakit ng dati katulad ng hypertension, diabetes, chronic renal failure, emphysema, at kaya kinakailangan din talaga dito ay ang pangangalaga ng ating pong katawan, ang kalusugan, ang resistensya natin. Huwag po natin aabusuhin ang ating pong katawan. Sumunod po tayo sa lahat po ng mga abiso, pagkalusugan ng Department of Health. Sa bandang huli, ang kalusugan ang siyang tunay na yaman. At kanya, huwag po natin baliwalain, huwag po tayo umabuso, huwag po tayo nagpupuyat, o pagka naninigarilyo, itigil na po sigarilyo dahil pag-alaman na rin po na ang mga naninigarilyo ay vulnerable din po sila to the deadly complications of critical and severe COVID-19 infections. No? So, yung po pagpupuyat, yung management ng stress, yung pag-inom na alcohol, ay ating pong iwasan na yan. Magandang pagkakataon po ngayon na talagang ating pong kalusugan ang ating palutangin at alagaan, paigtingin po ang ating mga programa sa hanay ng DOH ay to really improve our public health programs so that our people will be healthier. And this is, in the end, the most effective strategy against the COVID-19. Maraming salamat.
Thank you, sir, for accommodating us and for giving the IATF policy direction. We will now be moving forward to the presentation of Secretary Galvez. If we can share the screen.
ng National Task Force Against COVID-19 at sa ating IATF Chair, Secretary Francisco T. Duque. Magandang araw po sa ating lahat. Masaya po kaming balita sa inyo na inaprubuhan na po ng IATF ang ating Philippine National COVID-19 Vaccine Roadmap at ang implementasyon nito na binuo po ng masisipag nating mga kawani ng DOH. Ibig sabihin po nito, mas mapapabilis na natin ang proseso ng pag-angkat ng bakuna. Ngunit alam din po natin na hindi ito magiging madali. Kaya't puspusan po ang ating ginagawang paghahanda kasama po ng ating DOH. Ito po ay isang patunay na ang pamunuan ng Administrasyon Duterte at ang pamunuan po ng DOH ay mabigyan ng isang ligtas, epektibo at murang bakuna ang bawat mamamayang Pilipino. Ngayon pong umaga, sundan ko po ang mga briefing na ginawa po ng ating boss na si Secretary Duque na sa kanyang briefing may 3 andana ang ating preparasyon at ito po ay hinati namin sa 7 mga bahagi sa pagkakasunod-sunod. Una, ang masusing pagpili ng ligtas, epektibo at mura na bakuna para sa ating mga mamamayan. Ito po ay ginagawa po ngayon ng ating DOST, DOH at saka ito pong ating vaccine expert panel. Pangalawa, yung negosasyon para tayo ay magkaroon ng access sa supply na ngayon ay pinag-aagawan ng mga mayayamang bansa. Sa kasalukuyan po, kami po ay nakapag-uusap sa mga embahada ng ibang bansa para sa G2G o yung government-to-government at multilateral arrangement. Ang amin pong target ay makakuha po tayo ng at least 50 million na vaccine para sa 25 million nating kababayan coming 2021. Ang ikatlong stage po ay ang procurement process and financing na gagampanan naman po ng PSDBM at Department of Finance. Then ang kaapat, dito po ang magsisimula ang production, shipment, and storage. Ito po, medyo delikado po ito dahil kasi kailangan po natin ang 3 klase ng cold chain storage. Ikalima, yung distribution at deployment, ipapriority po natin yung mga naging sentro ng pandemya katulad ng NCR, Cebu at Davao City. Then yung ika-6 na stage, ito po ang implementasyon ng DOH ng malawakang pagbabakuna. Kaya po nakita po natin, sa ngayon pa lang po ay talagang napakataas ng preparasyon ng ating mga kawani sa DOH. Lalong-lalo na ngayon, niro-roll out natin ang measles, rubella at saka yung polio vaccine na magiging parang ating gagawing sinatawag na simulation para sa nationwide vaccine. At pagtutulungan po ito ng iba pang mga lokal at nasyonal na ahensya, kasama po ang AP at PNP. Lastly po, yung ikapito ay yung assessment and monitoring, lalo na pagka may mga tinatawag tayong mga hindi magandang event after the vaccine. Ito ang ating timeline at mga phases. Makita po natin na napakaraming preparasyon po ang ating gagawin. More or less 6 months po ang ating planning and preparation phase. Ang best case scenario po natin, baka po sa Mayo hanggang Hulyo ay may available na po ng mga vaccine through our COVAX at saka mga bilateral arrangement po natin. But realistically speaking, baka po end of the year or 2022 darating ang main bulk ng vaccine kasi talagang nakita po natin mayroon po tayong kakulangan sa supply dahil ang mga mayayamang country ay kinuha na po yung karamihan po ng majority ng mga production. Ito naman po ang mga specific major tasks na dapat nating magawa from assessment, planning, preparation, and execution. Ito po sa project-based na gagawin po natin sa nationwide vaccination, ito po nakaangkla ang mga tinatawag nating mga critical activities. Itong mga critical activities po nito ay may kanya-kanyang ahensya na gagawa po ng mga ito. And then lastly, ito po ang ating binubuong organisasyon from the IATF to NTF to our newly organized vaccine cluster. May 6 po tayong task group at may mga expert consultants po tayo tulad ng World Health Organization. Nandiyan din po yung tinasabi natin yung NITAG, ETSTAG at saka yung NIFIC, yung tinatawag natin na mga different experts na tutulong po sa atin all along the processes that we will be doing. Hindi po natin kakayanin ng pamahalaan ay sagawa ang buong planong nag-iisa. Kailangan po namin ang suporta ng lahat, lalo na po ang mga local government units at ang private sector. Napakahalaga din po na magiging kontribusyon ng ating mga mamamayan para po sa pamamagitan ng pagsunod ng minimum health standard hanggang wala pa pong vaccine. Huwag po tayo magkumpiyansa. Hindi po ibig sabihin na kapag may bakuna ay mawawala na po ang COVID-19. Mananatili pa rin po ito, kaya kinakailangan pa rin na lubos na pag-iingat hanggang lubusang mawala ang sakit ng COVID. Maraming salamat at mabuhay po tayong lahat.
Thank you, sir, for giving a presentation on the COVID-19 vaccine roadmap implementation. We have a few questions from the media, sir. I'll start po with a question of Greg Gregorio from TV5. He asked, since the president has been mentioning his preference for a COVID-19 vaccine, which will come from either China or Russia, has he made new and specific marching orders when it comes to vaccines being developed by manufacturers from either of the two countries?
Opo, meron na po. Dahil po mula nung sinabi niya po yun, nagkaroon na po tayo ng mga pagpupulong. At nag-present din po si Secretary Dominguez ng multilateral engagement. Nung nakaraang mga pagpupulong namin po, kasama po Secretary Duque, nagsabi po ang ating mahal na Pangulo na magkaroon po tayo ng G2G o government-to-government arrangement kasi madali po yun at saka nakaka-ensure po na talagang mababa po at talagang yung mga proseso napakaayos. So ang ano po natin ngayon, kaya po nagkaroon tayo ng briefing kay Presidente, sinama na po natin yung presentation sa kanya, ito ang modalities na pwede natin gawin. Una-una po yung COVAX. Yung COVAX po, alam po natin meron tayong WHO initiated, tinatawag nating solidarity trial. Dito po, meron na po tayong mahigit na 10 na countries na may bilateral arrangement na po sa ating DOST at saka DOH at meron na po tayong 5 na companies na nagkaroon na po tayo ng arrangement within the COVAX facility. So ito po ay pwede natin pong gamitin para doon po tayo makaangkat ng tinatawag nating secured na at least 20% ng ating population. And then aside from that, dahil kasi ang ano po natin, ang sinasabi po ni Presidente ay magkaroon po tayo ng vaccination to all our population at least yung 75% for herd immunity, kailangan po na magkaroon tayo ng bilateral engagement. So ngayon po, sunod-sunod po ang gagawin po ng DOH, DOST at saka ng kapulungan ng NTF para po tayo magkaroon ng negotiation na bilateral sa ating mga allied na countries katulad ng UK, Singapore, China, ito pong meron po na mga sa Australia at iba pang mga bansa na talagang gusto pong tumulong din po sa atin. Meron din po tayong tinatawag na multilateral engagement na pwede po na yung pooled ASEAN with the arrangement of the ADB at saka po ng World Bank. Yun po, kaya marami po tayong pwedeng gawin. Pwede rin po ang tripartite arrangement with the public sector.
Thank you, sir. Moving on to the next question po from Caroline Bonkin of CNN Philippines. She asked, for Secretary Galvez, would you know how the President came up with the decision to appoint you as vaccine czar? Paano niya po ito sinabi sa inyo? How challenging is it to split your time between the NTF and vaccine requirements?
Noong nag-uusap po kami, na isa sa mga kapulungan po namin, sinabi niya, siguro Charlie, ikaw naman ang chief implementer, dire-diretsuhin mo na para magtulong kayo ni Secretary Duque na maayos itong vaccine natin. So sinabi niya na ako ang magiging mamamahala sa sa procurement and management ng mga distribution at nandun pa rin ang ating Secretary Duque na talagang siya ang mga ngasiwa po sa vaccine. So ang parang arrangement po ay tutulungan ko lang po si Secretary Duque na mag-integrate, mag-synchronize at saka sa mga logistics portion kasi naiintindihan po ng ating mahal na Presidente na napakarami po ng ginagawa ng ating mahal na Secretary. So ang ginawa niya, sabi niya, tulungan mo na lang si Secretary Duque para mapaayos ang ating pagbabakuna.
Thank you, sir. Next question po from Aiko Miguel of UNDP. We will already have the list where to conduct immunization and what areas will be prioritized considering those who are part of the indigenous or poor families and details of zoning po.
Dalawa po ang priority natin. Priority sector at saka priority areas. Yung priority sector po, sinabi na po ni Secretary Duque, yung ating mga frontliners, yung ating mga essential workers and also yung mga vulnerable at saka poor communities. Yung sa area naman, yung zoning, titingnan po natin talaga yung tinatawag na yung mga areas na naging epicenter ng ating pandemic. So nandito yung Metro Manila, kasama na po ang Region 4A and Region 3, and then yung Cebu at saka yung Davao City. Kasama na rin po yung Cagayan de Oro kasi ito po magiging major hub po natin sa mga cold storage.
Thank you, sir. Next question po from Rafael Bosano of ABS-CBN News. Secretary Galvez in an interview said that the global demand of vaccines is far more than what can be initially produced. Given this, how can the Philippines be assured that it will be given a portion of the vaccine it needs? Since it is already in talks with manufacturers, have they committed into allocating for the country?
Sinabi ko na nga po kanina, yung ating COVAX arrangement and facility, it guarantees yung 20% through pooled financing at saka self-financing. And then secondly, may mga countries na talaga nagbo-volunteer. For example, yung China, yung Russia. Yung Russia gusto na dito mag-produce o mag-manufacture ng vaccine, which is pagka nangyari yon, so priority tayo for sources. And also there are countries that are volunteering to help us. Kasama ang Singapore at itong Australia and even yung UK and India. So yung lahat po ng lahat po ng mga countries na to, meron na pong bilateral at saka meron tayong tinatawag na multilateral arrangement through our COVAX facility and also with the DOH bilateral arrangement.
Thank you, sir. Moving on to the next question po from Nika Hanapol of Vera Files. How many more vaccines are in the pipeline that have not gone through the first stage of the National Vaccine Roadmap? Can we know their names, sir?
Sa ngayon po, may 17 po tayong tinatawag na ini-evaluate ng ating DOST at ang ating DOH at saka yung ating vaccine expert. Out of that 17 na vaccine na nakipag-ugnayan sa atin, 10 po ang may bilateral and then 5 yung nasa COVAX facility. There are other countries na gusto pong makipag-arrange sa atin, pero sa ngayon po nakita ko sa listahan, nagkaroon po tayo ng pagpupulong sa vaccine expert panel at binigyan na po nila sa akin ng listahan. Nandito po lahat ang 17 na listahan. Sa China po, 3 po na vaccine company. Sa US, 6. Sa Russia, 2. Sa Germany, 1. Sa Japan, 1. India, 1. Israel, 1. At may mga ibang countries pa na gustong magkaroon ng engagement with us. So, all in all, 17 po lahat ang mga vaccine companies with more or less mga 5 to 10 countries po.
Thank you, sir. Last question po from Aiko Miguel of UNTV also. Is it part of the DOH plan to conduct COVID-19 vaccination in police stations or military camps like President Duterte has mentioned in his previous speech? If so, will it still be in accordance with the protocols of processes for conducting immunization?
Yes, we will follow yung protocols of immunization ng DOH. And then ang gagawin po natin through prioritization, uunahin nga natin muna ang healthcare workers, and then after na makuha natin mga vulnerable, magkakaroon tayo ng vaccination dun sa mga kampo na sinasabi po natin. And pwede rin po natin gamitin yung kampo na maging vaccine centers. Kasi po kasama po sa aming plano, hanapin po namin yung mga tinatawag natin na mga hubs at saka mga spokes na pwede natin gamitin na vaccine centers. At isa po 'yon sa mga natin yung mga Philippine National Police at saka yung Armed Forces camps. So gagawin po natin po 'yon based dun sa instruction po ng ating mahal na presidente.
Thank you, sir. Sir, would you still have time to accommodate a few questions from the chat box?
Pwede pa rin po, wala po problema.
Let's start po with sir, I'll start po with a question regarding AstraZeneca. AstraZeneca said that it would be ready to supply the vaccine by January. In a Twitter post, Foreign Secretary Locsin said the government was in touch and deep in talks with the firm. May we know what are the initial agreements made, if any, and what are the vaccine expert panel's thoughts on this? How many doses do we plan to procure from AstraZeneca?
Based sa mga evaluation po ng ating panel expert, makikita po natin na sa green po ang AstraZeneca. Meaning green, maganda po yung kanyang evaluation na usual traditional vaccine na po siya. At alam po natin yung AstraZeneca is a very reputable pharmaceutical. And nakikita po namin maganda po yung kanilang nakapagkaroon po na po kami 3 engagement sa kanila. At pinesent po nila yung company profile. And sinabi po nila na ang pagbibigay ng vaccine ng AstraZeneca is to have an access for poor countries. At ang gagawin po nila is non-profit. Sa lahat po na in-evaluate po ng ating mga panel expert, ang AstraZeneca po ang pinakabababa ang kanyang presyo with $5 per dose. Yun po ang nakita po natin at ngayon po ang negotiation po natin ay tinitingnan po natin na magkaroon po tayo na access na at least 3 to 5 million pero inaano po namin na magkaroon pa tayo ng at least mga 10 million po na doses para sa ating mga frontliners.
Thank you, sir. Last 2 questions po for Secretary Galvez. We have another one. They're asking, sir, regarding Pfizer and Moderna. Are there any agreements being worked on?
I believe based doon sa po natin dito, mayroon pong tinatawag tayong bilateral arrangement with the DOH. At nakita po natin nung panahon na nandiyan po si President Trump, nag-usap po ang ating mahal na presidente na ipa-priority po ng US ang Philippines. So through Pfizer and other companies like Moderna, ay meron po tayong tinatawag na at saka yung Novavax, meron po tayong tinatawag na initial arrangement with DOST and our vaccine of expert. So dito po may 5 po na sinubmit po ang ating vaccine expert panel na probable contenders from US.
Salamat, sir. Last question po. You said that vaccine rollout may begin in May or July and that we may be able to buy at least 25 million doses by next year. Gaano po ito ka-realistic given that WHO said mass production of vaccines under COVAX may only be available by the end of 2021 at the earliest?
Yun po ang nakita po natin talaga realistically, tinatawag natin yung worst case scenario natin talagang end of 2021 or early 2022 ang pinaka po talaga ng vaccine, yung main bulk. But as of this moment, kung maging maganda ang rollout ng mga ibang vaccine and then maging maganda rin ang ating engagement and we can close yung negotiation within this year, mayroon pa rin po tayong pag-asa. Ang nakita po natin realistically, baka siguro mga 10 to 15 million ang makuha natin between May, June and July. Pero nagbabaka sakali po tayo sa ating mga allied countries na makakuha po tayo ng kahit konti.
Those are all the questions we can accommodate for Secretary Galvez. Sir, we thank you for your time and thank you po for supporting us in today's media forum. Salamat po, sir.
Maraming salamat at full support po ako sa DOH, sir. Boss ko po si Secretary Duque.
Salamat po again, sir. Secretary Duque is still on the line.
Maraming salamat, Sec Charlie, for your very comprehensive presentation and update. Maraming salamat, Charlie. You know, the president couldn't have appointed a much better person than Secretary Galvez, who has been tried and tested in many of the great challenges that this government has encountered, where Secretary Galvez has shown his mettle, his competence, his dedication and commitment. So mabuhay ka, Sec Charlie, and the nation is in need of you. Thank you.
Thank you po.
I
Secretary
can
Duque, we
answer
have
2 or 3 questions, Nikki, from our
Yes.
media partners.
Yes, sir. We have one question po for Brad Mendoza of the Manila Times. He asked, some commentators said that the appointment of different czars decreased the work that you are having as Secretary of Health and Chief of the IATF. Are you still in control of the overall COVID-19 response despite the appointment of multiple czars that also share the same job as yours?
Well, it's not really about control. It is really about seamless coordination and integration of efforts, no? Because this is such a yeoman's job. No one person can be able to lead in the response to COVID-19 pandemic that has, remember, brought the whole world to its knees. So dito, we need all hands on deck. And itong mga ating czars, so pinaka-latest vaccine czar, we have our testing czar na si Secretary Vince Dizon, who, by the way, we credit for our leapfrogging to a almost 5 million total testing coverage. No? And then we have the treatment and monitoring, temporary treatment monitoring facilities, the Secretary Mark Villar, who is also responsible for a continuing expansion of our TTMF facilities. And then we have our one hospital command czar, the treatment czar, in the person of Yusek Bong Vega, and our contact tracing czar, Mayor Benji Magalong, is really a testament to the fact that these people have really proven themselves, their competencies. They have a long track record of successfully managing many programs of government. That is why the IATF had been unanimous in recommending to the president the appointment of these various czars. So, kailangan talaga ang underlying philosophy in our response is the whole of government, whole of system, and whole of society approach. So it's not a question of who is in control. It's a question of the plan, a very clear and well-coordinated execution of the plan. And the more, the better, for as long as the plan is crystal clear. And then the execution is also in order. The milestones are clearly identified. What are the major success or accomplishments every step of the way? Dapat malinaw po yun. And at the end of the day, we shall have to answer the questions such as, have we brought down the number of our COVID cases to a level that will allow our health system to respond, okay, very efficiently and very effectively. Now we see that because of all of our preparations over the past few months, we have ramped up our health system's capacity, and that is why if you look at our critical care utilization rate, it's low. No, it's less than 50% for both, I think, national and for NCR. No, in fact, our TTMF bed capacity is at a 38% utilization rate. So all of our preparations have finally produced the results that we have wanted, precisely to be able to respond to any possible surge in the number of cases without overstraining or overstretching our health workers, our health system's capacity, and so forth. No? So yan po masasabi natin. Thank you.
Thank you, sir. I know you have a tight schedule, sir, but one more question po from Claudette Moconsariaco of the Business Mirror. She asked po, once the vaccine will be made available, do we have adequate resources to ensure delivery of COVID-19 vaccines to everyone?
Well, that is part of the planning that our vaccine czar is doing. He will orchestrate all the efforts, the implementation by each of the three major components of our national vaccine, COVID-19 vaccine roadmap. No? So yung vaccine development, yung vaccine procurement, and the vaccine distribution rollout plan include what you just mentioned, whether meron ba tayong enough resources. Congress is a partner in this endeavor, and the House of Representatives in the General Appropriations Bill that was transmitted to the Senate has included there an increase of the COVID-19 vaccine to 8 billion pesos, 5.5 billion more than the 2.5 billion that was prescribed by our budget secretary, the DBM, and the DOH. I think the Senate is also contemplating on setting aside a 10 billion standby fund for COVID-19 vaccines. Thank you.
Thank you, sir. Secretary Galvez, can you also add more to what the Secretary of Health had said?
Yung pong kailangan po natin, magkakaroon pa tayo ng tinatawag nating Logistics Service Support Summit. Doon po natin i-discuss ano po yung mga requirements na gagawin po natin. Kasama po doon ang tinatawag nating yung production, shipment, and storage, at saka yung tinatawag na yung distribution and deployment. Marami po tayong kailangan dito, kasama po ang tinatawag nating mga volunteers. Kasi if we will have tinatawag nating rollout, may mga volunteers po tayo na kukunin ng mga doctors and also mga healthcare workers para matulungan po ang DOH, at ito po isasama po natin sa budgeting. Secondly, yung ating logistic requirements, nag-usap na po kami ng mga logistic chain. Kung ano po yung mga requirement, nandito po si Yusek Kobotahe na meron ng more than 30 years na experience sa immunization. Nakita namin na talagang well-planned. Talagang pinakita niya na pagka 2 to 6 degrees, ito yung kayang-kayang i-deploy sa mga regional health unit natin. Pagka negative 20, hanggang sa level 3 na hospital natin ma-deploy, at saka pagka negative 80, kailangan na natin ang private service providers. At nakausap na po natin ang consortium ng different logistic chain, at yun po, mag-uusap po ulit kami para makita po natin yung overall deployment plan. Dahil kasi pagka once na nagkaroon po tayo ng tinatawag na-identify na po natin yung tinatawag na vaccine centers po natin, doon po natin titignan yung magnitude ng ating deployment at saka redeployment. Yung pong gagawin po natin, dalawa po yan, kasi kung dalawang vaccine yan, kasama po dalawang redeployment, ibig sabihin dalawang ulit natin gagawin ang isang massive rollout. Kaya yun po, kasama po yan sa plano natin.
Secretary Galvez, we have one more question po related to budget. Gabby Parladi of the Daily Tribune is asking, Senator Franklin Drilon earlier expressed doubt that the allotted 2.4 billion in the vaccine procurement allocated from the national budget may not be enough to procure your projection of around 24 million COVID vaccines. May we ask for your reaction to this? And will more budget be added to the current fund to reach the projected amount needed by the country?
Maraming po salamat sa comment po ni Secretary Drilon, pero dapat po na malaman ni Secretary Drilon na yung ating advance procurement program, hindi po pwede po yung budget natin dyan. Kailangan po talaga yung multilateral engagement with our credit partners, kasama po ang ADB at saka yung tinatawag nating World Bank. Malaki po ang credit rating natin at nakapag-prepare na po ang ating mahal na Secretary Dominguez ng possible amount na kayang-kaya po ng ating credit account doon sa World Bank at saka sa na makuha yung tatawag nating advanced procurement program para sa mga vaccine po nito. Ang ating pong pondo ay kasama po ang Bayanihan 2, meron po tayong 10 billion. Meron din po tayong 25 billion sa Bayanihan 2 na standby fund for COVID-19 response. Aside from that, kung magkakaroon ng additional 8 billion plus more or less mga siguro from 5 to 9 billion dollars na pwedeng i-credit account sa atin, napakalaki na po na pondo na naka-allocate. Kaya po kumpiyansa po ang ating mahal na presidente na meron na siyang pera at kukuha pa siya ng pera para sa vaccine.
Salamat po, sir, once again for accommodating all of the questions from the media. Mr. Crisette, before we start po with our regular media forum, we would like to thank our principal, Secretary Duque, and Secretary Galvez for joining us in today's media forum.
Yes, gusto lang ho namin pasalamatan, of course, our Secretary of Health, si Secretary Francisco T. Duque III, and of course, si Secretary Galvez, na nag-miss po sila ng maraming meetings para mabigyan po ng information ng ating media ngayon regarding our updates on our vaccine implementation. So thank you again very much, Secretary Duque and Secretary Galvez. Maraming salamat po.
Thank you, everyone. We will now be moving on to the questions for the Department of Health. Mr. Crisette, I'll start po with the question of Caroline Bonquin of CNN Philippines. Several people have been infected with a mink-related strain of COVID-19 vaccine. Prior to this, there were also reports of coronavirus cases in cats and dogs. The WHO said it is possible that a virus may be passed on to humans. Will the DOH issue additional guidelines regarding this, given that many Filipinos have pets and there are also many stray cats and dogs in the country? Are there any related reported incident here? And given the possibility that animals may be spreading SARS-CoV-2, paano po ang posible na pwedeng gawin?
Yes, alam mo, Caroline, nung nag-uumpisa pa lang yung pandemic, lumabas itong mga issues or articles na ito coming from, I think that was in China and then Singapore, na infected daw yung dogs, infected din yung cats. And then of late nga, nasa mga articles na yung mga mink. So, ang unang-una natin kailangang tignan, no, yung evidence na pinalabas ng US CDC noon na sinasabi nila primarily talaga ang SARS-CoV-2 virus is transmitted from human to human. But of course, we are not discounting the possibility that maybe later on, baka nag-mutate at pwede na rin magkaroon ng ganito. Pero sa ngayon, wala pang sapat na ebidensya that from the animal to human or human to animal. Wala pa hong ganon. Ang meron pa lang tayo sa mga evidences natin is really the human-to-human transmission. So how are we going to prevent this, if ever, or avoid this? So ganun pa rin po, minimum health standards pa rin po tayo. If we only do the masking, meron ho tayong palagi ang pag-uugas ng kamay. And of course, our pets, no, should always be clean, no, para po hygienic din tayo at nakakapag-prevent tayo ng iba't ibang infection na manggagaling sa ating mga animals or sa mga pets. So until we get enough evidence to support this claim, that's the time that we will be issuing out protocols. Nick?
Thank you, ma'am. Next question po. May we get an update on the talks with private companies who are interested to put up a fill and finish facility for COVID vaccine? And bakit po nagtatagal ang ethics committee sa Sinovac review? Last time po kasi, FDA said it might just take a week, pero it's been 3 weeks na po na nasa kanila.
Yes, so first would be the fill and finish, no? Kasama ito, Caroline, dun sa medium-term plan natin for vaccine implementation. So bakit ba medium term? Because it is not really parang ganong kabilis para makapagpatayo tayo ng mga ganitong planta dito sa ating bansa. Although our experts and our partners already have scope, no, etong mga kakayanan ng ating mga manufacturers dito sa ating bansa. But still we are having this kind of discussions, no? Ang ating plano for this would be that there would be this public-private partnership, no, para dito sa fill and finish na ito. Meron na pong dalawang manufacturers who have signified their interest to establish this fill and finish here in the country, and it's just going to be somehow parang modular, no, para mas madali nilang maitayo, and yung long term na lang pag-uusapan how we can be able to use this afterwards. Pero meron na hong mga pag-uusap, pero ang sabi ko nga, this is a medium term plan. It is not really to be done immediately, but definitely baka by next year po nag-uumpisa na po ang mga proseso natin for this kind also, because it's part of our plan for these vaccines that we will be having. Second, yung Sinovac. Yung Sinovac, katulad ng alam nyo lahat, nakapasa na siya sa Vaccine Experts Panel, and yung sa Ethics Review Board tayo nandun. So when we look at the process, it is not just the regulator o kami dito sa gobyerno ang dapat tignan, kailangan compliant din yung mga nagsasubmit sa atin. We have already provided the Sinovac ng mga kailangan pa ng ethics review board natin. May kailangan pa sila na additional documents for them to complete their evaluation. So we are still waiting for Sinovac to comply with these documents that we have requested. Once they comply, mabilis naman po i-expedite yan. And aside from that, while waiting for that, FDA already has started reviewing yung kanilang initial documents para pagdating sa kanila, hindi na rin po matatagalan ang proseso. Nick?
Thank you, ma'am. Moving on to the next question from Greg Gregory of TV5. As Sinopharm's phase 3 clinical trial nears end, have they expressed intent to register their vaccine here in the country? If so, do we expect this as the first COVID-19 vaccine to be procured by the government? And when is the earliest projection?
Yes, ang Sinopharm, at the outset, they initially said that they would want to have clinical trial here. That was according to DOST. I think Secretary Boy has mentioned that last Friday. But after a while, because they have this advanced clinical trial phase 3 already, they said that they are not interested to offer nga na magkaroon ng clinical trial. Gusto na nila yung for marketing na yung kanilang produkto. So until now, we have checked with the FDA, wala pa rin silang application for registration sa FDA. So aantayin po natin na mag-register sila para ma-i-undertake na natin yung regulatory process so that we can determine how fast or how soon this kind of vaccines na makakapasok dito sa ating market and can be used. We will be informing everybody. Pero ngayon, wala pa silang application.
Thank you, ma'am. Last question po from Sheila Chrysostom of the Philippine Star. While there has been an overall decline in COVID-19 cases nationwide, which provinces, towns, or cities remain problematic or are still seeing a rising trend? What are the reasons for this increase? And what are the status of the indicators in these areas?
Yes, Sheila, for the indicators that we use, we will give that to all of you dun sa ating Viber group because marami pong data yan at maraming detalye. There are specific areas that we are currently monitoring because of the increase in the number of new cases. Tama ka, marami na sa ating mga lugar ang talagang nakikita natin ang trend sa pagbaba. Pero may nakikitaan pa rin tayo na pailan-ilan na nag-i-increase ang kanilang new cases. And specific for that would be yung ating yung Sarangani, yung Eastern Samar, yung Ormoc City, at saka yung Dinagat Islands. Meron silang increase by as much as 200% dun sa ating ginagawang indicators. And for Ormoc, atin po silang tinawagan, meron po silang detected cluster kasi ng healthcare workers. For Eastern Samar naman, apparently, ang sabi nila, this is because of their increased testing capacity. And for Sarangani, they said that there is this monitoring being done at titignan nila kung bakit meron silang mga clusters sa ngayon. As well as for Dinagat Islands. Pero sa Dinagat Islands, ang sabi nila, binuksan daw po kasi nila yung port nila coming from Surigao. That's why they are observing and they are assuming na iyon. Pero of course, lahat po ng sinabi natin ngayon na reasons for this observed new cases should still be validated. So aside from the local governments validating it, DOH also has a set of criteria to validate also kung bakit po nagkaroon ng mga bagong kaso dito sa mga lugar. So we will be informing everybody once we are done with validation. Nick?
Thank you, ma'am. We have a few questions po from the chat box. Ma'am, do you still have time to accommodate a few?
Sige, Nick.
I'll start po with the question of Greg Gregorio of TV5. He asked, JTF COVID Shield Commander Guillermo Elizar suggests banning caroling this Christmas season. May we get the DOH reaction on this? Also, what's DOH take on shopping during this holiday season?
Yes, so meron tayong pinalabas yung department circular ng Department of Health kung saan nagkaroon po tayo ng mga paalala sa ating mga kababayan regarding ito pong mga activities natin during the holidays. So, ang usual activities during the holidays, katulad ng sabi nyo nga, yung caroling at saka yung mga reunion ng bawat pamilya. So, nagbibigay paalala po tayo. Unang-una, may lumabas po na pag-aaral. This is just last week that we got it, na ipinakita nila na kapag ikaw ay may certain activity, how much load of the virus can you transmit? At pinakita dyan, meron ho dyan yung pagsasalita, meron yung paghinga, meron yung pag-ubo, pagbahing, meron yung pagkanta, meron yung pagsasalita ng malakas. At naipakita po dyan yung pagkanta ng malakas, no? Yan po yung pinakamataas na porsyento or highest yield of the virus if you are infected, mas marami kang nailalabas. So isa ho yan sa ibibigay nating paalala para sa ating mga kababayan, no? Na with this kind of activities, nandyan po yung probability na mas makakapaghawa tayo ng infection kung sakaling tayo ay may sakit. So we recommend still minimum public health standards should be complied properly. And of course, iwasan natin kung makaiwas po tayo sa mga ganitong gathering. Tandaan po natin ang mass gathering, no? Yung allowed number of people to congregate is still based on the community quarantine level of an area. If you are in a GCQ, you're only allowed 10 persons to congregate for this specific type of activities. And for when you're in an MGCQ, ito 50. Pero kailangan strictly complied pa rin ang minimum health standards. So yun pa rin po ang ating ipapaalala, whatever our activities would be for this coming season with these small sales, with this caroling and all, lahat po kasi yan pag-uusapan pa sa IATF. So I cannot provide you with a definite answer now. Pero coming from DOH, we still remind everybody minimum health standards po and avoidance of this kind of gatherings kung kaya naman po at may iwasan natin. Nick?
Thank you, ma'am. Last question po from Lanesca Panti of GMA News Online. She asked, Yusek Verhere earlier said that the confidence on the government's vaccination program is very crucial in implementing the COVID-19 vaccination. What are the steps that we are going to take to ensure that such confidence is robust enough?
Yes, that is really critical, yung kumpiyansa sa bakuna. Kailangan paniwalaan ng tao itong ibibigay natin sa kanila na ito'y makakabuti sa kanila. Kaya pag tinignan niyo po yung pinakita ni Secretary Galvez tsaka ni Secretary Duque na implementation plan natin, ang pinakauna po dyan is engagement of the community and of course engagement of our local government officials. Kailangan po ng buy-in, kailangan po natin silang makatulong para mabigyan ng enough information ng ating community on the aspects of the vaccine, its harmful, its adverse effects kung sakasakali, ano po ang ikakabuti nito, ano po ang purpose nito at bakit po tayo nagbibigay nito. Kailangan po yan ay matanggap ng ating mga kababayan, maintindihan nila na ito ay safe. Kailangan din po maintindihan nila na ang gobyerno, hindi rin naman po tayo papayag na basta papasok ang kahit na anong bakuna dito sa ating bansa kung hindi ito dadaan sa ating stringent regulatory processes. Kaya po lahat yan dumadaan sa FDA, naglagay pa ho tayo ng safeguard, bumuo tayo ng vaccine expert panel so that we can provide that confidence, no, para sa komunidad na ito pong ibibigay sa kanila ng gobyerno ay ligtas at ito po ay effective and efficacious para po sa ating mga kababayan. It's going to do yun pong sinasabi nilang pagprotekta sa kanila against this disease, no, yung COVID-19.
That is the last question for today. Today has been an eventful Monday morning, ma'am, with the attendance of Secretary Galvez and Secretary Duque. Ms. Secretary, your final message before we end today's forum.
Yes, agree ako sa iyo, Nick. No, I think this today has been very, very informative and has been significant, no, because we have our Secretary of Health and we had our vaccine czar with us, and sa tingin ko naman nasagot lahat ng gustong maitanong ng ating mga media partners. So maraming salamat uli po kay Secretary Duque at saka kay Secretary Galvez, at wag po kayo mag-alala, uulitin po natin uli ang ganito mga pagkakataon na nakakasama po natin ang ating mga secretaries para makapagbigay po ng mas maraming information sa inyong lahat. So ang sa atin lang po, sana po, no, we can request, no, that matulungan niyo po kami sa pagpapakalat ng balita ukol dito po sa ating bakuna at sa ating plano, at sana po ay masabi natin sa ating mga kababayan na sinisiguro maigi ng gobyerno na ito pong mga bakunang papapasukin natin ay dadaan po sa ligtas na pagsusuri ng ating mga eksperto, at yun lang po makakapasa sa ating regulatory processes and the evaluation of our experts ang makakapasok at ibibigay sa ating mga kababayan. So we will see all of you again on Wednesday for our regular media forum. Maraming salamat po sa inyo lahat. Thank you very much, Nick.
Thank you, ma'am, and to all our media partners. Happy Monday po.